Good morning, guys. Tony Maritato here, licensed physical therapist. And so you guys always hear me talk about massage. I wanted to touch on the difference between the massage gun massage and the rolling pin massage. So I'm not going to get into the technical issues or factors, but basically the massage gun to me is more about the sensation. The way I use it, the way we typically use it in the clinic, especially post-op after a knee replacement, is we turn it on. I'm not going to turn it on because then you won't hear me. We turn it on, we allow it to just kind of glide as it's producing that percussion. That is really the sensation that we're getting the benefit from. I would not consider this a deep tissue. I personally prefer the sustained pressure of the rolling pin over the percussion of the massage gun. Both feel good, both have benefits, both do a great job, and you might feel differently. If you do, let me know in the comments below between these two, which one you like better. But I can tell you that for what I want to achieve as a physical therapist in terms of tissue work, tissue health, fluid exchange, healing, I find that the rolling pin actually does a better job achieving the goal that I have for my patients. The massage gun feels great, but like any sensation, whether it be heat or cold or electricity with the TENS unit, it tends to be superficial and it doesn't necessarily facilitate the same response. When I'm doing a massage with the rolling pin, whether I'm doing it to the patient or the patient's doing it for themselves, what we can do is we can actually apply a sustained pressure. We can draw the fluid and the pressure back toward the heart. We know that the lymphatic system was affected during the surgery. We know that fluid's accumulating. These percussion instruments just aren't going to move fluid the way something like a rolling pin will. And my top priority in the first 4 to 6 weeks of healing is to facilitate that fluid exchange, to move the fluid out of the area, because with it, it brings the waste products out, it brings the nutrients in, it helps the body do what it needs to do to heal. It helps the immune system do what it needs to do to heal. So all in all, I prefer the sustained pressure of a rolling pin or anything similar, but I'm not saying that the massage gun is a bad idea. You see me use it in the clinic with several patients. I use it on a daily basis. This one has been one of my favorites so far. It's the Tiaha. They did send this to me as a gift to test out, and it's been doing great. I've had it for several months. It's consistent. It's powerful. The battery has great battery life. But a basic rolling pin, $5 wooden rolling pin, $19 metal baker's rolling pin, whatever you have, marble, this is what's really going to help to move that fluid, reduce the swelling, and facilitate tissue healing. If you guys have a specific massage device that you like, also let me know down in the comments. And if you haven't already, please consider subscribing to the channel. My goal for 2022 is to grow this channel to over 100,000 subscribers so we can help get this information out to the people who really need it most. I'll catch you guys on the next video.